And so I was fortunate to get funding from the U.S. National Institutes of Health to do just that, to develop biomarkers to diagnose CTE during life. The study that we refer to as DETECT involves 90 former American football players, professional players, all currently between the ages of 40 and 69, people who played positions with the highest amount of exposure to repetitive brain trauma. And at the time of coming in for their evaluation, they have to be symptomatic. And by symptomatic, I mean problems in the key symptoms of chronic traumatic encephalopathy that include cognitive difficulties, especially memory and executive dysfunction, things like multitasking and planning and organization and judgment. And then also problems with behavior, difficulties with impulse control, having a short fuse, being rageful, violent, and problems with mood. In other words, having difficulties with depressive symptoms, hopelessness, and suicidality. In addition to those 90 former NFL players, we're studying 30 or so controls. These are same age, elite, non-contact sport athletes. These former athletes who played sports that did not involve hitting their heads, and they had no other brain trauma exposure in their life. When they come in, what we're doing is we are conducting around 3 days of assessments, including extensive neuroimaging by my colleagues Dr. Shenton and Lin at Harvard Medical School. We're doing lumbar punctures to be able to look at cerebrospinal fluid, and in this case, what is important for today's presentation is CSF tau, and these are being done by my colleagues Drs. Trojanowski and Shaw at the University of Pennsylvania, as well as Dr. John Mann at Columbia. We're doing electrophysiological studies, genetic studies, extensive clinical examinations with neurological evals and motor assessment and neuropsychological and psychiatric tests and interviews. And we're getting a lot of blood products that we can bank for novel blood biomarkers. And in this case, an important blood biomarker is this wonderful new approach by Quanterix using the Simoa platform to be able to measure plasma tau. This is the first time that we can measure tau because it is in such minute concentrations in the plasma that heretofore it's been impossible to really measure and detect well. The CSF tau findings, I'll show you some preliminary findings just to put this in perspective. We have shown that when we compare our high-risk group, those who played football, and the low-risk control group, we did find a significant difference in the ratio of phosphorylated tau to total tau, as well as differences, but not significant differences, in total tau and phosphorylated tau. But today what I want to show you is our results using the Simoa platform measures of plasma tau. The question is, does brain tau cross the blood-brain barrier? Well, you heard in Dr. Mondello's wonderful talk that at the time of injury does seem to be some alterations of the blood-brain barrier. In our case, when we're looking chronically, yes, indeed, there seems to be destruction of blood-brain barrier through vascular changes, and we are hoping that we'll be able to see measures of tau in the plasma using Simoa. This has been seen in concussed professional ice hockey players. This was in a paper that came out in JAMA Neurology, where there were significant tau differences in preseason to postseason in these hockey players who had concussions, where the tau levels in plasma were significantly elevated after the season. It's also been looked at in Alzheimer's disease, and plasma tau levels have been able to distinguish different severity levels of Alzheimer's disease. This was a paper in Alzheimer's Research and Therapy. So what about in our subjects with presumed chronic traumatic encephalopathy, these former football players who are at high risk and currently symptomatic? Well, what we did was we took a well-matched group from our overall DETECT study of 30 former NFL players and 10 age-matched controls, and Quanterix conducted all of our assays using the Simoa platform. And what we found was, in a comparison of CSF total tau and plasma tau, we found a pretty strong correlation. It was a Spearman's row of 0.4, and you can see the scatter plot here.